Hello, hello, hello. This is Truth Be Told. This is Dr. Walter Aka.
And my name's Dr. Leroy Horton, and I've got the pleasure,
Oh,
and I'm gonna tell you why.
come
Because
on
I
now.
cannot get away from this man. I go to my Facebook, it's the JW method. I go to my Instagram, the JW method. I go all the
Yes.
way to New Orleans, and who do I see receiving a 40 under 40 award
Come on now.
on stage being celebrated for the greatness that he brings to the table?
Come on now.
I'm gonna let Dr. Jared Williams introduce himself because the world needs to know who you are, brother.
Come on.
Oh, he's shy now. You
Oh,
can.
he's shy?
He's shy now.
He's shy.
I'm wondering. I want to see what route I should take on this one because I know that there's booby traps all over.
No. Listen, the interview hasn't.
I take that with respect. I say that with respect. I know whom I'm in the presence with. No, it's an honor and privilege to be here with you all. I'm Dr. Jared Williams. I'm in Houston, Texas. I am a traveling surgeon. I do thirds, implants, and IV sedation as a concierge dental surgeon. But when it comes down to what my passion is, it's actually teaching GPs third molar surgery. And so we have a program that we specifically focus on general dentists that want to get in third molar surgery, that have little to no experience to be proficient in third molar surgery in under 4 weeks. And so we have docs who are doing cases that would blow your mind in less than 4 weeks. And anytime I ask them specifically, why are you able to do that? They're just like, I just follow the principles. And that's like real big on how my training program goes. So, I really want to disrupt what dentistry is. I believe there's a lot of gatekeepers that are present. And when I was in dental school, I used to see how it was only for the smart people. But I see that a lot of smart people either cheated, slept with teachers. Am I not supposed to say this?
Oh,
we're going a whole different direction. Okay.
Hey,
I told you,
buckle up.
Listen,
yeah, we could go out the gate.
Where's my tea? Where's my tea?
Loosen my tie.
Let me get my thumbs up. Let me get the pinky going.
It gets real fast. And so when I saw that and I realized that I wasn't necessarily not smart, I was a late bloomer. And so I realized, like, wait a second, I want docs who were like myself, not fully, they don't know their gifts just yet.
Right.
And so I believe if I give them the information from a perspective of somebody who was always trying to figure it out, but now I have the blueprint of success for a $3 billion industry, and individuals want to get that insight, I'm all for it. Because this is like, so I put stuff up on Facebook and Instagram and I see who's watching and I see the number of degrees behind their name and I see some of the hate that I get. And I appreciate it because I believe that this is an actual gift. I mean, I've been doing this for mentoring for like almost 18 years. I had individuals getting into dental school. So mentor is in my blood, and then just teaching is just an extreme passion for me. So that's just me in a nutshell, but I'm pretty sure you'll have some other questions.
Okay.
Oh, no, we got questions. I mean, I like the way it started already.
Yeah.
Right. One thing that stands out completely. One thing that stands out completely is you said you have a 4-week course, correct?
Mm-hmm.
No. As a matter of fact, no, it's not even a 4-week course.
Okay.
So there's different courses. So we have our 5-day challenge, which is coming up on Sunday. That's a 5-day. That's just more so like an introductory into third molar surgery.
Okay.
And our goal is there for individuals to get an idea of what third molar surgery is and actually implement it after those 5 days. But specifically, the training programs that I have an online course and I have a hands-on live course. And individuals who've either taken the hands-on course or the online course, like they're doing some phenomenal things. I'll show y'all some pictures, some items, if we have time. But
we are here for you.
But just to give you insight, like individuals who have like the first day they met, 4 weeks from there, they're doing cases that our most specialists wouldn't even touch.
Okay. And so here's the one thing that I know everybody's going to say. Everybody's going to say, wait a minute, 4 weeks, 5-day challenge, right? Like, it sounds like a TikTok special, right? It's 5-day challenge, this, and we're going to have the ice bucket challenge and all this other stuff, right?
Get shredded in 7 days.
Right, right. The problem is a lot of people are going to say, wait a minute, an oral surgeon goes to school for 4 years.
Minimum.
5 years, 6 years, right? A periodontist goes to school for 3 years, right? How are you able to do and have people that are proficient enough with a 5-day challenge or a 4-week challenge or whatever it may be? How does that work where, you know, somebody might go, wait a minute, do I trust that? And I can guarantee you, you got surgeons and other people who are looking at you, you know, kind of side eye.
Good.
Going, this guy is either ripping people off or he's dangerous to the community of dentistry. Tell me if I'm wrong at any time here. I'm sure you
know you're checking all the boxes. I'm glad you brought them all up.
So please break that down for us, how this is possible.
So how is it possible? So number one is this. I like to be very transparent, right? So first things first, I come from a background of 2.46 GPA back in undergrad, right? I went to Oakwood University. It's in Huntsville, Alabama. It's the same college that Eric Thomas, the hip hop preacher, went to, right? So if y'all have heard of him, we went to the same undergrad, right?
Okay.
When I was there, I had this 2.46 GPA. Now my dad is an Army Ranger, and I don't want to call him because I feel like, if you remember Ghost Dad with Bill Cosby, he was talking to his son, and his son was he did something, and he reached through the phone and started choking his son. Okay. And I felt that my dad would do that all the way in Houston, Texas from Alabama. And so here I am about to speak to somebody who kills people for a living, literally trained, and I'm like, yo, like, I'm about to tell my dad, who's literally going to kill me on the spot. But I built up the courage. I was just like, hey, I have a problem. He was like, what, son? What? And so I finally broke the ice to him. He was just like, oh. He was like, just get with the smartest person in class. And he hung up. And I was like, no beating, no, I'm gonna come down there, none of that. And I'm like, yo, this is crazy. And so what happened was I took that advice and I was able to finish up college. I got in dental school my first try. I never missed any test. I never failed any test, never had to retake any test. Passed all my boards on the first time, got in the residency of my choice. And I was like, there's something to this. Okay. And so he just told me to get the smartest person in class. And so after getting through college and then through dental school, I was just like, let me just marry the smartest person in class. And that's my wife now of 12 years. So with that,
you just got so many points on that, brother.
You did.
That was the smoothest, calmest.
You did.
Man, you listen. You get points for that one. You get points.
That's true. So your wife is a dentist as well.
She's a physician.
A physician. Okay.
Yeah, she's a physician. Yeah, one per family. One per family.
Okay.
But so what happened was I just been following that same principle over and over and over and over and over. And so that's the key. And so all this information I got, it didn't come from me. It came from, and I can't say that, God came and touched me, an angel, all this other stuff. I would say, like, I literally humbled myself to the best of the best in the business. And, like, if you work with anybody who does things at a high level, they're going to expect it out of you. Right. You're going to expect it out of yourself. And then if it's a gift, oh man, you're just going to end up taking it to the next level. So that's how I got to this point. But the whole, what is it?
How do you teach somebody? How do I teach? Yeah. How do you teach somebody what an oral surgeon takes 4 to 6 years to learn? How do you teach them in 4 weeks?
So they're not even, so honestly, so I have a lot of friends who are oral surgeons.
Okay.
But they're not learning how to do exodontia for 4 years. Let's be
that's third molar extraction.
Yeah, third molar surgery. So that's not even something that a lot of oral surgeons can't even take out third molars, because they, depending upon the program that they go to, or depending upon their attendings, it's like, you'll figure it out. Like, we're going to do Lefort's. We're going to do, some pathology items that are more higher up on the whole grand scheme of things. So with that being stated, it's just like, that's.
Well, let me ask you this, Dr. Williams, what do we say? And let's go call you Jerry. We're on a first name basis here. Okay. So Walt, tell me if you didn't hear this in residency, because I've been hearing this left and right. Okay. See one, teach one, do one.
Very true.
There's no, in most programs, there's no concerted, protracted, like Jared was saying, where you're doing nothing but thirds day in, day out for years at a time. And that's what we call proficient. It's literally as easy, even though you're paying all this education, and you're spending all these years to be a specialist. for a lot of things is see one, teach one, do one. You watch your senior resident do it, and you're like, okay, that's how you do it. You do it, and now the next time you're teaching the next resident to do it. So I think Jared hit the nail on the head.
Right.
When we say that there's extra training, what I've seen is there is a a program that you're a part of that does have some condensed experiences.
Okay.
But as a GP, you can get those same amount of reps, same amount of experiences. It just may take you a little bit longer if you're, getting it on your own. Right. Or if you got someone like Jared who's put a package together, you can get it in a condensed form on your own time with someone who presumably you're spending a lot of time with them one-on-one, Jared. What's that? What's it look like?
So it just depends upon the program that they end up taking. I was going to pull up a picture so you can actually see some of the docs that we work with. But so it just depends. Like if somebody wanted to have like a little intro, like that's coming up on this Sunday. We have 5 days. If you do, the general package, you'll just end up hearing me lecture. If you want to do VIP, then you could end up asking all the different burning questions.
All right, let's do this. Let's do this. I want you to tell me. Okay, so I'm going to sign up for your course.
Yeah.
I'm signing up for your course. I hear great things about you. I see you on all my feeds, right? You've done something amazing. You've gotten on every single buddy. I mean, I don't know who doesn't see you on their feed, right? What is the first thing you're going to tell me to do? I don't know anything about thirds. I'm interested in it. And most of the time I'm interested in it because I know that if I start doing thirds, one, that's increased revenue for my office.
Yeah.
Right. So let's not lie. And we're not saying that we're doing this for the goodness of our heart. We want to increase our revenue for our office. Correct?
Yeah, absolutely.
Right. So I want to take your course. First thing I do, besides sign up for your course, I sign up for your course. What are you charging when it comes to the different levels? Right. And what do I do? What do I do to be, from the beginning, middle, and end? Like, how does that look for me?
Well, the thing is, this is that, so how most programs will do, they'll tier you in. They'll say, you got to start here, then go here.
Right.
I don't believe in that. Like, where do you want? Like, I meet the person where they are. Like I've had individuals, who have more dental practices than they laid flaps. They come through the program and they're taking out horizontal impactions, completely boning.
Okay.
So to me, it's like, once again, like this is a gift of mine, right? So teaching is like a gift. Like I believe I was born with that.
Right.
So the thing is, this is like, I meet you where you are. I don't believe in like baby stepping, because the thing is, this is like, as a GP who goes to different practices like yourself, like you're going to see certain things that you may not otherwise want to see, but because it's the nature of your practice and docs are relying upon you to provide this service for their patients, there's certain things that you have to just do the best that you possibly can, of course, following the standard of care across the board. But to answer your question, like I really just meet the doc where they are. If they want just the blueprint, take the online course. If you want hands-on, come down to Houston and we'll actually do that. If you just want to, I don't know, let me see if this guy's a snake oil salesman or whatnot. Right. You could do the lowest entry, which is a 5-day challenge. But the thing is, but let me get to this.
Yeah, please.
The thing is, this is that I do not shy away from social proof. Like I've done over 12,000 cases. I'm a clinical assistant professor at the dental school, the graduate program. Okay. Like this is not fly by night type of thing by any stretch of the imagination. So, I've spoken at several, at the dental school several times as like a paid a speaker. So this is not like, run of the mill. Like I've been doing this for years. I have a real big this has been grassroots approach.
Right. You're official. You're official. And that's what I love about
can I say this one thing? Can I just Black and official. Let's throw that in there as well.
Black and official. Yes, sir. Yes, sir. And that's the beauty of it. And let me tell you why I love watching what you do from afar up here in the Northwest. Similar stories. I'm a GP. I've been a GP for 13 plus years. Got extra surgical experience in school. And it sounds like when you did your residency, it was very similar. You got extra training. I came out and, you can be gifted with your hands. And if you have the confidence and the wherewithal to challenge yourself to grow, you can be just as skilled as a GP. And I tell Walt this all the time. I know so many GPs that can run circles around specialists, right? Not to say that there aren't amazing specialists out there, and not to say that there aren't bad GPs, but it is not the specialty in and of itself that makes anyone a good surgeon, right? Or a good artist, right? If you think of yourself as a surgeon being an artist, you know, Picasso and Van Gogh, they had no degrees. Right. In fact, they both started school and in less than a year, they dropped out, right? But they're renowned artists with their hands. And that's what I see, you know, and what I love about you is that you demonstrate your cases, because I've seen your cases all over Instagram, on social Facebook. Media.
Yeah.
So you show your thirds, you show before and afters, you show yourself in the clinic working, and I applaud that 100%. I do want to dive a little deep in this notion of, I call it the Phil Jackson effect, right? If you have the Michael Jordans, the Scottie Pippens on your team, you're going to win a championship if you're Phil Jackson or not.
Kobe.
If you got the Kobe and the Shaq, right, you're gonna win a championship. And I feel like that's what a lot of programs do. They choose people that they don't have to work for. What it sounds like you are, and I don't know, you know, you're definitely a lot younger than me and Walt, but yes, if you look at the 89 Pistons with Coach Daly, not one player was on the All-Star team that year. But he coached them to a championship.
Right.
So you said that teaching is a gift, and I love hearing that. So tell us about how you honed this gift and how you found that that's what your calling was.
So I would say, you know, my mom, she was a primary school age teacher for 30 years. And that was something that probably just kind of fell upon me. And then my dad being a military staff sergeant, ranger, Army Ranger, like, you know, guiding platoons, guiding men to either live or die. So it's like I got it on both sides, unbeknownst to me. And then, you know, I want to say having the struggles of having that 246, I had to like figure things out quickly. And I've always felt that, you know, once I figured it out, because I had such a undesirable start, you know, it forced me into my brain just kind of figured things out. Like I was listening to a podcast the other day, I was talking about how Kyrie Irving, how he's able to play on the court and, you know, throw the ball. They were talking about how he had no backboard. Certain parts of the backboard were missing when he would play basketball. So his mind would kind of think of different ways to make shots because he didn't have the regular size backboard that other individuals have. I would say it's the same exact thing. There's certain handicaps that I had, but I didn't necessarily look at it as a handicap. And since I was just faithful over a few things, I was made rule over many. And so that's one of the main principles that I start with docs. Anytime they come in, the first thing I tell them, I was like, I guarantee, and I always put guarantees on it. Like I can't like, I guarantee this. I was like, if you're faithful over a few things, you'll be made rule. This program, like I could literally show you before and afters of their first start. Like in our programs, it's not unheard of. We've had multiple doctors come through our Hands on Live program, and they're getting 5-star reviews from their patients the day one they're sitting in the chair.
Okay. Well, okay. So I guess I'll play devil's advocate tonight.
Please bring it to me.
Right. I can teach anybody to do surgery. And I say that without disrespect, right? I can teach anybody to do surgery. It's not the teaching to do surgery part. It's how to manage complications, right? The knowledge to manage complications, I think, is what separates any good surgeon. Tell me if I'm wrong.
Yeah, absolutely.
Right? And so what do you do to make sure that people aren't going out there after your course and not hurting people? Because sometimes I've seen where they'll take a course, okay? Doctors, GP, surgeon, specialists, who cares? They'll take courses and they're like, okay, I've done this. Now let me go ahead and go to this next level of intensity. And I'm like, but wait a minute, you haven't even been proficient in this part, but yet you want to do this other stuff. And we have to look out for patients. And so how do you make sure that people just don't take your knowledge that you give them, the little knowledge you give them? It's like, I always tell everybody, and everybody knows this if you watch or listen to the podcast, I think when you graduate from dental school, you're smart enough not to hurt people.
Yeah.
Right. But it takes a lot to get to the point where you're proficient enough to be good at what you do. And I'm asking you, after 4 weeks, right? How do you know that these people are good enough to be let go and to know that they're going to come to you if they, you know what I mean, if they need more? Does that make sense?
Yeah, it does.
It's not
Same
just,
way.
oh, let me just go ahead and do stuff and okay, cool, see ya.
So it's the same way the University of Pitt did you.
Okay.
Gave you the skills and let you go about your business. You got to
Right.
make the decision. That's it. I mean, there's no difference.
Okay.
Your clinical professors are no different than myself or yourself or Dr.
Right.
Horton that are
For
on
sure.
there.
For sure.
So, but I mean, I don't know how to answer that because nobody's given a refund if they get their license revoked or if they get a lawsuit.
Okay,
I mean,
right.
you're going to have to just put in the work just like
Right.
everybody else. But specifically for me,
Mhm.
because I've had all the challenges that come along with third molar surgery, because I've had the exposure, I'm literally telling them, don't do this or
Okay.
this will happen. I'm giving them the whys, right?
Okay.
And so I remember Dr. Tyus at Meharry Medical College, he said the difference between a dental assistant and a dental hygienist and the doctor is that between the two of those, the dental assistant and dental hygienist, they don't know the why. As a doctor, I know the why. And as a professor, I could tell them, don't do this or this will happen. And so most individuals will only remember maybe 10 to 20%, maybe even less now because of social media with the amount of information that we're given at this point. And so it's up to them, like I said from the beginning, if you're faithful over a few things, you'll be made rule over many. But then again, it's just like individuals are going to make mistakes. And that's up to the professor or their mentor to still be with them. And so any doc that takes any one of our programs, we have a VIP Discord that they're able to stay in the community. So when, not if, but when stuff hits the fan, they have access to docs around the globe that are able to assist them through the challenges that come with specialty procedure.
Okay. Well, let me ask you.
Okay. Go ahead.
Let me ask you this real quick. Have you ever come across a doctor that had so many red flags, whether it's hand-eye coordination, their critical thinking ability? You know, sometimes it's in the questions that they ask. You can be like, okay, if you're asking that question that way, you must really not know X, Y, and Z. What, if anything, would make you say, all right, I need to pause on this person?
Okay.
And, you know, maybe this person isn't right for surgery, or is everyone a case that is just a challenge that you take on?
Well, the thing is I've been through the fire, right? I have literally earned every notch that's in my belt. So I don't think there's any case or any clinician that I have to, like, of course I have to be prudent with any doctor. Like the leash will be a lot shorter with these individuals, but I don't think there's any type of case or situation that if a doctor is really humbling themselves to get the information, that I will actually be there with them. As you got to remember, like I've been in the graduate program for maybe last 3 or 4 years now at here at UT. So, you know, they come with every aspect and I'm there maybe once a month. And so these individuals who barely know how to lay a flap, they're taking out third molars on patients who are, you know, end stage renal disease because they need that tooth to be taken out for their treatment. So for me, it's just like I treat everybody the exact same way. And here's an example. I got this. This is some midazolam some dexamethasone. The first thing I tell docs, the second thing I tell docs is this. I was like, can you see this? What's going on right here? What principle am I operating right now?
You want us to answer that?
Yeah, please.
Gravity, kinetic energy.
Gravity. Yeah.
If I do it with my left hand or my right hand, it's gonna be the same exact thing. If I do it with my eyes closed, it's gonna be the same exact thing.
Okay.
Third molar surgery is the same exact way. As long as you follow the principles, you're guaranteed a result.
Okay.
Period.
Well, okay. So now that you say that, I want to add what are these principles? I mean, you basically are saying it's like when somebody says I have the magic code for, you know, how to have a successful marriage and stuff like that, even though we know everybody's different, we know that people come with different anatomy and so forth. What is this code or something that you have that no one else seems to have? Can you tell us, like, what is this code that you have that makes it so easy for you to teach? And I don't disagree that your teaching is, you know, a gift or whatever. That's not what I'm asking. I'm asking you, what are you doing different than anybody that I can go to, other people that are also teaching the same courses? Like, what do you do differently? Can you break that down for us so basically make you stand out?
I would say number one, I'm extremely transparent. I don't hold any punches on where my limitations are or where I came from. That's number one. I think a lot of doctors, just in general, they have this cloak of invincibility.
Okay.
There was a doc who said to me, "Hey, this VIP Discord that you have, it's so comforting because I could literally admit defeat. You can't create that in some of these other Facebook groups that you have, other programs out there." And so just the ability for vulnerability, I think that's number one.
Okay.
I would say
that's not easy to do in our community.
Hands down.
Not.
Yeah,
hands down. That
was
the number one thing that
Okay.
somebody could say, somebody who has a degree, went to an Ivy League and all these different things. I could feel comfortable admitting defeat. You can't do that as a doctor. Everything has to be perfect. Everything, even if it's not perfect, even if you leave a little something that you know shouldn't be there. So I would say that's the number one thing. And if you allow somebody to see that they have warts and you don't criticize them and they have a safe space, those individuals can flourish so much more than everything's on edge. And coming from Ivy League, GPR, University of Pennsylvania, like I know what that feels like. Even going to Meharry, HBCU. So I understand what that feels like. And so just to be able to create that space of excellence, but then vulnerability and then exposure and, the track record, then you have the 5-star reviews and then you have all the doctors that come along with it. Like it's a lot of things that add up to it. But the number one thing is vulnerability.
But what technique do you use that makes it easier for them to learn how to do thirds? Does that make sense?
Good question. So because this course is specifically for GPs,
right?
I use everything that a GP does, from cutting a class 2, from cutting a crown prep, in third molar surgery.
Break that down.
For instance, if you look at the contemporary oral maxillofacial surgery, I think they're on version 5 or 7. They lay a flap like the whole jaw, right? I say no, everything needs to be laparoscopic. So everything's 8 millimeters and 8 to 10 millimeters max. In oral surgery, they train you to do troughs, like take out all the bone to take out the tooth. I say no, we're going to do crown-like prep cuts, which means you're only going to have the thickness of a 557 burr, which is like 1.7 millimeters in thickness, right? And so by doing that and preserving those tissues, I don't even lay flat. I don't even do sutures for all you, since y'all are periodontists. I don't even.
You just stabbed us in the heart, but go ahead.
I want to go there. I don't even use sutures. I'm like, I teach docs how not to use sutures because you could take out 95% of the teeth without laying a huge flap.
And these are impacted, meaning underneath the gum?
Impacted third molars, 7241 with complications. Like the only time I'm laying a suture is if the flap tears.
But primary closures heal way faster and better. So you're telling me to keep it open.
I'm glad you said that.
I know.
The whole purpose. Yeah. So the whole purpose.
That's why I said it.
So the thing is primary closure is not good for third molar surgery.
Break that down.
So what happens is when you do primary closure on third molars, there's a likelihood of fluid to build up and you have a huge mass and swelling. So it's opposite. You want to have the opening of a drainage that actually takes place.
So I mean, I'm not gonna lie to you. That is completely opposite of everything I've learned.
Excellent. Yeah. So there you go.
No, I mean that, and I'm not sure about you, Dr. Horton, but I've never heard that. I've never heard, because if you keep it open, most people will get debris and stuff in that area, which will cause
false.
But that means you're assuming that patients are going to keep that area nice and clean.
I tell my patients, number one, number two is this. I tell all my patients, eat whatever they want as long as it doesn't hurt. Popcorn, candy, everything that you could think of. And patient, I know, I want you to just say, oh my goodness.
You are on some other level now. I was with you. I was with you until you said that right there. But go ahead, please. I want to hear this out.
But the thing is this, if you think of it, if my flaps are about this big,
right?
And if you lay a flap and you open it up, you go do a prophy check or whatever the case may be, and you put that tissue back, you literally those tissues are so tight that it's already creating that closure that you already need. So we're fearfully and wonderfully made. We just have to flow with how the body's created. The thing is this, the reason why it doesn't make sense to you is because you were taught from in oral surgery when you're treating, they're laying these huge flaps. So of course you need to suture, you need to tack those back together. But if your flaps are maybe 10 millimeters, and you're not creating a lot of traction, and there's tension on that. I mean, there's tension on that flap, which means it's going to go back. Then what's going to end up happening? It's going to end up healing on its own. That's why for me, I haven't used narcotics in maybe the last 5 or 6 years. I'm using ibuprofen, Tylenol, and Paradex. I don't even give patients antibiotics.
Or antibiotics. Let me ask you this, because
please. I have a lot of questions now. Now I have a lot of questions that I'm like, okay.
Because it seems like like I said, our story arc is very similar, right?
Yeah.
I'm gonna describe a case to you, and you let me know,
please,
how far either close or away it is from the similarity to what you may do, right?
All right.
If I got a fully impacted third on the lower, right?
Yep.
Usually I'm doing a.
So hold on for a second. I just want to describe. So basically, your gums are completely covering the tooth, right? Every time you go to there's bone over it and there's gum over it, so you don't see it when you look inside the person's mouth.
Right.
Go ahead.
Can't see
it. My incision will usually be a crestal incision that's slightly buccalized. I may lean towards the distal buccal a little bit, and usually I'll do a vertical incision just distal to the second molar.
Can we do this? I'm actually going to share a screen to show you what he's talking about. Okay, if you don't mind. I want to share a screen here to show him exactly. Can everybody see?
Excellent.
Right.
Okay.
So this is basically what he's saying.
Very similar.
Right.
Only I tend to do my vertical, not diagonal, the way they have it shown. I do it straight up and down to stay distal to the line angle.
Okay.
I definitely don't, not for third molars, I don't extend with sulcular incisions to.
This is what Dr. Williams was saying. This is what Dr. Williams was saying.
Right.
That you basically, oral surgeons have been taught to come all the way to the first molar and extend it all the way far back here, right?
Terrible.
And he's saying that that's not at all what he does. Dr. William, where do you actually start your incision? Do you come like to the second molar and go back, or do you just stay right above?
If you give me the ability to annotate, I'll show you exactly what you do.
Yeah, I believe you can do that, but go ahead, Doctor. I'll switch it over to you.
I got it right here.
Perfect. Let me end my share. And then what I can do is
keep what you have.
You got it?
Yeah, I got it. Yeah.
Okay, cool.
I'll show you exactly what you do. I'm so glad you do that. You guys are periodontists. Every time you lay a flap, what's going to happen? Bone loss is going to happen. So you're going to have sensitivity. So you don't want to do that. So you just created bone loss on first molar, second molar. You're screwing up the patient just because you want an effective procedure. It's trash. Okay. So here we are. Let me annotate this real quick. It's going to be in pink, my daughter's second favorite color. So this is what I do.
That's Walter's first favorite color.
It is.
Hey, you got to know what you got to.
Listen, real men wear pink.
That's it.
Okay.
That's what you got.
You know why Jared, why I asked? Because me and you got into a short debate the last time we talked, right? To me, you said small flap. I said you got to be able to flap it to see it.
Yep.
But we're literally just using different words to describe the same thing. That's exactly how I would do my incision right there.
And if anybody's looking,
I'll tell you why.
And if anybody's looking real quick, if anybody's looking on the video, and I want you to pay attention if you're watching us on YouTube, is you can see on the right side, he marked it in pink, which is beautiful. As you can see, he doesn't even extend it like what an oral surgeon or what oral surgeons are meant to do, right? He basically makes an incision straight down, right? Straight down the tooth. So if you can follow he just comes straight down this tooth right here, which then leaves the soft tissue or the gums right on the teeth, right, that are there, the first molar and the second molar. He leaves it right on there, so he does not mess with them at all. He says, let me focus on this area that has the problem, right, the tooth that needs to come out. Correct?
Exactly.
All right.
And so and another thing is this: the reason why I leave that the reason why I lay the flap that we do right there is because it doesn't disrupt the periodontal apparatus on the distal of 12.
Okay. Okay.
Yeah.
Well, so here's another
Okay.
thing. Here's
Yeah.
okay. So it kind of makes sense. So you're actually still doing the same exact. You are still creating enough access so you can see everything.
Yep. The base of the, as long as your base is wider than your apex, you're gonna get all this visual that's present in this area because your base is gonna be over here.
Right.
So when you open up this apex towards the distal, I mean towards the buckle, you're gonna see basically the majority of the tooth that you need to see.
Right.
And that's, my friends, why you don't need to you don't need to place any sutures or anything. So that tissue is gonna fall back.
See, that's the part that confuses me, because despite everything, you've made a vertical incision, right? So now you basically have a big envelope. Imagine what an envelope looks like.
It's not big. It's not
okay.
big at all. It's not big at all. Because the thing is
Okay.
this is that this little envelope right here,
yeah,
on this picture, it looks big.
Right. Well, yeah.
But it really, I'll show you, I'll share my screen and I'll show you what I'm talking about.
Okay.
But it's not as big as you think. And the reason why, because I'm going maybe 2 millimeters past the mucogingival junction. So this is going to be 4 and this is 2. So that's maybe 8 millimeters once again. And I open this up, and then a lot of this tissue back here is keratinized. Keratinized gingiva is very tight and strong, so it's going to want to come back. This is not non-keratinized gingiva, so it's not going to be all flabby. This keratinized gingiva is going to want to fall right on back to the surgical site. Okay. So as long as you don't have any bony spicules that are in that area, and you didn't tear the flap from over here or over here, it's going to end up falling back on its own.
Okay.
Well, I tell you this much. Well, I can attest to that because I do.
Right.
I've been doing third molars for so long.
Right.
The tissues in the back, I rarely ever put sutures in the top because the tissues are tucked so far back anyway, right? Mm-hmm. And in the lower, I would say maybe half the time, I'll put a chromic gut, knowing it's going to melt out in a few days. Okay. But I think on this one, given the design that Jared is showing, I could definitely see why you wouldn't need, because you are also working in a space that it's kind of protected because it is so far back, right? Even if you're chewing with your second molars, by the time you're swallowing, that bolus of food is bypassing the outer corners of your mouth.
Okay.
Right. Okay. So yeah, I'm with you. I'm with you so far. Okay. Yeah, 100%. So I do got a question for you. When it comes to someone performing surgery, what cases are you telling your doctors to avoid? Like, what does it take? Because I've seen some of your x-rays, right? And some of them are 2-dimensionally close to the nerve, but we know 3-dimensionally, that could be a whole different ballpark, right? It could be here, but 2-dimensionally looks like this. When you are dealing with your doctors, how do you progress them? Or how do you teach them to think critically to assess their own progress as they start encountering more and more challenging cases?
All right. So I'll give you a specific scenario. The number one thing that GPs do, they always screw up, is they always look at the crown first. That's terrible. You should look at and this is for coding and I guess assessing the difficulty level. I don't use Pell and Gregory. I think it's useless. I know people are going to come after me for that, but whatever. I think, I want to go there. Hold on.
Be honest. Because right now you basically taught us that being a specialist means nothing.
No. I'm not going to do no.
No. I mean, honestly, the 3 years was waste my time.
No. So first things first.
Yeah.
I will never disrespect the amount of energy and the amount of sweat and the amount of pain that individuals had to go through in order to get a degree. Right. I will not jokes aside.
Yeah, he's just teasing you. Yeah.
No. For all those that don't know me like that. Like I'm not saying this for you. I'm saying for all those that are out there listening.
What I'm saying isn't that. I mean, I'm joking around, but here's the one thing I want to make clear, right? A lot of oral surgeons, most of their days are spent doing thirds and doing implants. Right? Most of them, they don't do Leforts, which are like jaw surgeries or anything critical, right? Most of their time, I'm going to say 60 to 70% of their day is spent doing thirds and implants because of the return on investment is pretty high. And you have a program with that within 4 weeks or plus or minus, right? you're doing the same thing that 60 that oral surgeons spend 60% or more of their time doing. So again, I'm being funny, but I'm not. You've basically said the reason to go to oral surgery, the reason to become an oral surgeon has been eliminated. And we have to be honest about that. Right?
No,
But hold on. If you were teaching 30%, I could understand that statement. But if you're teaching more than 50% of what most oral surgeons, most periodontists do, then your program eliminates a lot of the specialty track. Am I wrong?
Well, so yes, I would say you're not wrong. I would say let's look at it from a different perspective.
Okay.
Now, oral surgery is not just exodontia.
Agreed.
So to reduce an oral surgeon to the level of just the exodontist, that would be a slap in their face, right?
But do you agree that it's 60% of their practice?
That's their decision.
Okay, I'm not saying that it's not. No, but what I'm saying is most oral surgeons do that, correct? 60%.
They go to. Hold on. Just like so that is hold. Go ahead. I'll get your question out. Go ahead.
No. I mean, that's what I'm saying. I want us to be honest about what we're talking about here, right? And I want us to understand that no one is being disrespectful by any stretch of imagination.
Yeah.
Because I don't take offense if you told me that most periodontists want to just do implants. I would say you're absolutely correct. Most of the time, the easiest. The fastest return on investment are implants, right? That's why you got general dentists that want to do implants, endodontists that want to do implants, right? And if you said that the perio is in trouble because everybody wants to do implants now, I would agree with you and say you're right. Right? It doesn't mean that we all of a sudden don't mean anything. We all of a sudden aren't useful. I would just say now we have to open up our war chest and say, okay, we need to focus on other stuff. And that's what I'm saying to you. Your program,
we need to adapt. Because honestly, Jared, it sounds to me like you're cracking the code, and I appreciate that.
Yes, and I agree. I 100%. I think that's true. There's no disrespect there. I think you're taking it wrong. I don't think you're disrespecting oral surgeons.
No, because the thing is, this is that reason where this is coming from is that I have screenshots of multiple surgeons who have put posts on my pages, and it was just like very, very outlandish, like to the point that doctors are staying up at 11 o'clock at night putting in paragraphs. I got screenshots. I could throw it out there of individuals, and they're saying like, yo, I've like, for instance, I literally had this, I was at what is it? SmileCon in Houston. I had a booth up. This white lady, oral surgeon, came up to me. I want to paint the picture. She comes up to me. She looks at my booth and she's like, we're in competition. I'm like, what? I'm like, what? Excuse me? Now, I don't know this lady from Adam. She didn't say hello. I didn't speak to her. She just said, we're in competition. I was like, excuse me. Now at these programs, you see this big old sign that says who you are, where you're from, and then at the bottom, your credentials. And hers said oral surgeon. And I said to her, how do you mean? She was just like, we're in competition because you're teaching people how to do my procedures. I was like, oh, you must think that I'm here fly by night. I was like, no, I'm a professor at the dental school and I'm training GPs how not to push teeth in the sinus and sever the inferior alveolar nerve. So you don't have to be at the hospital taking care of it. And she was like, oh, I like you. And everything flipped. Everything flipped.
Right.
So the thing is, this is like, the reason why I'm putting this out there because the reason why dentistry is the way that it is because it's a money grab. And the thing is, this is like, I'm literally disrupting it because I think the research was 2018 or 2015, third molar surgery was a $3 billion business with a B. Billion. That's almost 7 years ago. So let's just imagine what it is now. So the reason why I'm bringing this up is because there's individuals out here that are creating these gates for individuals who desire, but they can't. And for those individuals, I'm like, you're going to get a finger and read between the lines. But for all the other docs that are out there that are wanting to make this dentistry as a whole better, they're going to welcome this because I'm not going to be teaching an individual how to just take out a tooth and then, 1 out of 3 goes into the sinus and they have to take care of that. Like if we're true to what this game is, do no harm, then individuals should be championing me to say, hey, man, thank you, because now I don't have to deal with that booker. I don't know about you. Like, nobody likes to deal with a complication that they didn't do.
Right.
So I'm just here in the gap saying, hey, don't get on YouTube and not pay for a course.
Right.
Don't try to figure it out on a couple of posts on Instagram. No,
Right.
get the training so that you could legitimately have excellent results and you get smile after surgery.
You know what I think it is? Yeah, smile after surgery. I like that. Listen. Walt, let me pick your brain a little bit. So one thing as I've been traversing academia that I've found is that a lot of the different specialties are very protectionist.
Yes.
Like Jared just said, they're just super protectionist.
Yeah.
So I've been in a lot of discourses with certain faculty members, always seemingly defending GPs because they trash mouth GPs all the time.
Yes.
It's just a culture. Right.
Yes.
And in my head, like, I get so revved up about it because I came in very bright-eyed and bushy-tailed thinking, all right, we're all on the same team, right? We're all colleagues, we're all collaborative. The amount, I know there's some tribalism in general, right? When it comes to any aspect of life as human. I was not as prepared to see how prevalent it was in the academic setting. And I could see how if you didn't have any experience and you just went straight from predoctoral studies to your residency, and then for 3, 4, 6 years, all you heard was how amazing you are.
That's it.
And how trash GPs are.
That's it.
I could totally understand why a fair amount of specialists that I ran into over the years were assholes.
That's it.
Right?
That's it.
Not because they were that great. They were just assholes. And in my head, I never really understood why until I see where that culture comes from. And so I am not surprised that lady stepped to you. I'm glad you were able to diffuse her, right? So I think, part of our responsibility is not just to combat, it's to win over, right? It's about community building, right? Do you fear at all any backlash? Let's say you have a complication one day, knock on wood, that goes to litigation. Mm-hmm. They're going to go to that local oral surgeon to be the expert witness. Right. And the way luck works is going to be that one that's been seeing you doing what you do. Gotcha. Right? Got you.
That's it.
Do you fear that at all? As much as there's competition and protectionism from the specialist community?
And can I add? Do you fear that for your students as well?
No, because once again, if you follow principle, if you follow all the check marks so I train GPs to operate at the above the level of a specialist when it comes to thermal surgery specifically, because I know that, number one, let's not disregard the obvious. I am young and Black in Texas. Right? I just want to put that out there for everybody that's just like, oh, I'm young and I'm Black in Texas.
Yes.
Right. So I understand what's going on. But the thing is, this is like, I have a graduate. I finished a GPR. When you do a GPR, or all those GPs that are watching, anytime you do a residency, they just kind of, okay, if you don't have that level of training, you're kind of messed up. Then I've worked with so many different doctors here in Houston. I'm at the dental school. Like, I have been doing this for years. Like, I've done so many free dental days with so many individuals, like nationwide and globally, to where it's just like, if they're going to get me, hell, whatever. I don't even care. But the thing is this, you're not going to get me. Like, if you're going to get, like, because literally you can be caught on any little technicality. It's just only a moment of time. And so for me, my focus is not to be scared of what can happen. It's just, let me put as much goodwill out there so that if something should happen, they could say, well, you know what? Hey, we're going to let this one go. And if I get hammered, I get hammered. So it's just like, whatever. But I'm not going to shy away from the fact that individuals who are desirous to want to learn, am I not going to give that because some idiot, some jerk, some clown is going to be like, oh, I got him, whatever. I mean, that could happen with a cop, young Black in Texas. Like, it doesn't.
Let me ask you a question. You travel around and you do these procedures, right? What is the hardest thing about traveling and not having a stationary office that you find, especially when you do surgery?
So for me, I don't think there's anything, because thermal surgery is kind of like a class one feeling for me. Another thing is this, because of I've done so many mission trips and working in with nothing, like I'm prepared. Like I never have my own assistant. I'm always working at the different assistant at the office that I'm working with. And I've done this for 12 years. So, there really is no scenario that I would not feel comfortable in. I mean, I went to Meharry. I don't know if y'all know about Meharry, but like we were trained to work with next to nothing and have excellent results.
Right.
And I used to think that was a joke until I went to an Ivy League trained school, and I'm like, what are these clowns doing? Like, what is going on here? And so I just think of it just a testament to where, when you have a so-called handicap, but you don't see it as a handicap, like going back to the reference of Kyrie Irving, you're able to make things that are impossible look extremely easy, and people want to just like dissect you because you're able to do that. So there's no challenge. I think it's challenging to stay in one space to where you don't see everything that's going on. You could just bury your mistakes. Just, oh, we'll come back for that. We'll take care of that later. Oh, let's go somewhere else. But I have so many people looking at me. I have the doctor, the assistant, office manager, the patient, and then the biggest eyes, which are my own. So
yeah, I'm glad you said that, because I do quite a bit of traveling. I've been doing it for years. I had my home base offices, but I had kind of a network of offices that I went around and did third molars. And one thing I loved about third molars is it's definitive. I get them out, rarely ever have any complications. But I got a hard-hitting question for you. All right. Your wife took your last name?
Yeah.
You're both Williams? Okay. So I'm at the Williams house.
Williams, yeah.
All right. So I'm at the Williams house and I'm having dinner because I'm in Texas and you invited me over, right?
Yeah.
You shouldn't do that. You shouldn't do that, by the way. But go ahead.
I start having chest pains. Okay. I pass out. Which Dr. Williams do I want running to my aid?
The one who is a physician.
There it is.
I defer. Like there ain't no pride in me, brother.
That's awesome.
The one who is greater than I. Who is greater than I.
So I got another question. So whenever it comes to, that's a great question. That's a great answer. Whenever it comes to with you sedate patients, right? You put them to sleep.
Mm-hmm.
And you said that you work with different assistants. How do you make sure that they're trained properly enough to kind of assist you as needed? Does that make sense? Because if you're doing the sedation and the surgery, how do we make sure that we have enough assistance? That was the one thing that basically got me to stop sedating people, was because I didn't trust the axillary help around me, to be honest with you, right? Because in my mind, you have to have a level of understanding of sedation, not just myself, right? You need to
or monitoring,
right? Or monitoring. So how do you account for that? How do you cope for that, especially when there's different assistants coming in and out for you in different offices?
So number one is I use only one drug for sedation.
Okay.
So there's only one drug, one reversal. I'm very regimented in terms of how I give medication. So how I give medication is just for you to forget, not to knock you out. And like you have all these TikTok videos. I think that sedation is dangerous. There was a cardiologist who was killed by an oral surgeon for an implant. I want to say maybe 2 or 3 years ago. I'm pretty sure you heard about that. Okay. And they have all the equipment in the world, capnography, the whole nine, and you still have people dying. It's not about I want to say it really goes back down to the clinician who's in charge of it all. They have to have control over everything, even if they have all the bells and whistles that are present. If you have those items, there's a likelihood for things to be smoother, but it doesn't eliminate everything. So with using one drug, one reversal, and then in addition, just training the staff before we even get started, letting them know what I expect from them and what I require. And then also having my head on a swivel, because at the end of the day, I could have a CRNA in there, and if something happens, I'm on the line. So it really doesn't matter from that perspective. I mean, of course, we're not doing, cowboy or being mavericks. But I mean, I've done thousands of cases, and, I've had complications. I keep all my training up to date, work with the best of the best. And, I always let patients know if something were to happen, you're going to be the lucky person. but it's not because I wasn't prepared or I wasn't ready. It's literally going to be because you were that individual. And I think that if you operate in that capacity, then things just go a lot smoothly. And then another thing is this is like, I only do cases that are that I feel comfortable with. Like I had a doc, she reached out to me. She was like, "Hey, I have a doc who comes to the surgery for me. Can you sedate for me?" I was like, "I'm not doing that. I'm not sedating for any other doctor. I am not a nurse. I'm not a dental anesthesiologist. And so I will sedate for my patients because I know what the medications are going to do to the patient and what I expect from them. But I'm working with another doctor. Like, no, like one, and here's it for all those that are listening. Let me drop this little pearl. I really can't stand that so many docs are doing surgery without throat packs, placing implants, taking out teeth, things going to the back of the in the lungs, and that's just a $10,000 fee just for anesthesia alone. So, to go back to the point about the sedation, I have everything like blueprinted out, like it's a system, like aircraft control. Like I know I'm going off check boxes on everything, so my staff knows what the expectations are. The patient knows, and we have a plan already in place so that when something happens, not if, but when something happens, we're able to deal with it.
And are you doing IV?
IV
when you just do the one
IV,
medication,
one
it's IV.
medication.
Okay.
Yeah.
Isn't it beautiful when you're so regimented that your assistants know your next move?
Yeah.
It makes surgeries so easy, so fast, so efficient. Well, listen, brother, I know it's getting late. I know you are 2 hours ahead, so I'm not going to keep you. We're not.
He's about to have dinner.
Yeah,
we're about to go to bed.
But we love to have you back on, man. I think this is a wonderful conversation. I think that the insight of your specific position as a GP that has seemingly cracked the code, and I don't say that tongue in cheek. I say that with all due respect. I feel like I said, our story arcs are very parallel, which is why me and Walt thought of having you on. But is there any parting words, whether it's when you want to plug your program, any last pearls you want to drop on us before we call it a night?
Yeah, so my management would definitely be upset if I didn't say go to thirdmolarsurgery.com for our 5-day challenge coming up. So it's thirdmolarsurgery.com.
There you go.
It's going to be in the show notes. We'll put that in the show notes.
Yes, so absolutely coming up. So definitely do that. I would just say this. If there's something that you want to do, I would say this: get a mentor. I'll leave these 3 things. Get a mentor. How do you know how to find the right mentors? How do they make you feel? Are they practicing what they preach? And do they have social proof? Reviews. That would be the thing that I would say for any doc that's trying to figure out, hey, how do I get into this? It may not be me, it may be somebody else, but at the end of the day, if you follow that, you're going to realize what looks hard is often easy.
Can I ask you one more question? And I want you to kind of end this for us.
Sure.
When it comes to dentistry, do you find it that, like you said, you mentioned this at the beginning, that there are a lot of gatekeepers? When it comes to dentistry, do you find it that it's better if we kind of have a collaborative effort and we say, okay, you know what? Let me put it another way. A lot of specialists get angry or afraid that, oh, the general dentist is doing this, my procedure. And I put that in quotation, right? But you're basically telling us, listen, anybody can do a lot of things. It's a $3 billion industry. There's enough to go around. We need to be okay with people doing certain things so that we can then learn from each other and expand and actually treat the patient accordingly, right? Do you think that that's where dentistry needs to go? Or do you think that it's just like, it's always going to be, you stay here, you stay here, you stay here. Basically, you stay in your lane. Does that make sense?
It's all, I would say, I hate to say always, but it's always going to be like that because it's all about the dollar.
Yeah.
So, we could have ideals, but like until capitalism is still the apple of everyone's eye, that's never going to happen. So unfortunately, it's not something to be upset about. It's just to, everybody has a gift that they were put on this earth to give to this world. And I would say that each individual, if it's specifically within dentistry, they just need to find their space and shine their light, give the knowledge, make this world, make your patients smile, have your assistants smile, have your office managers smile. And, you know, if you have the opportunity, give back to somebody who wants to fill your shoe, sit in your seat one day. But, you know, I'm not going to sit back and cry about it. I'm going to, you know, feel uncomfortable so I could, you know, leave my mark or what, you know, what the creator put me on this earth to do. So
Awesome.
that's what I would say.
Well, with that, I think let's call it a night, Walt.
I agree. I 100% agree. Thank you.
Yes, thank you, bro.
so
That
much,
was
Dr. Williams.
lovely.
You know,
Appreciate
what I
it.
would love to do actually would be maybe have you come back and just kind of show us some cases, because we talked about the fundamentals tonight, right? But now let's talk about some of the cases that you do and that people can do when they go through your program. Right? We've asked you all the tough questions. We've basically made sure that you're legit. Now show us. You see what I mean? And I think that'd be the best thing to do, because I get a chance to see it on Instagram and Facebook and so forth. I've gone through your Facebook. And by the way, how did they get a hold of you on Facebook, Instagram, and so forth, minus just that one website?
Yeah, so I would say the JW Method on Instagram. You do that, and there's also YouTube as well. So the JW Method, and you could find me there.
Yeah, I mean,
Awesome.
you should. Everybody should, honestly, because he puts a lot of stuff up there, and there are a lot of doctors that are with him that are very happy with what he does. You know, we have to challenge each other when we come here. We always say that in our podcast. We have to challenge each other, and patients have to challenge us. But it's good to always have somebody who's so transparent to basically make sure that, you know, we keep everything 100%. You know, so we definitely thank you. Thank you for coming through. We definitely appreciate that. And you got a lot of brownie points. I'm probably not going to have my wife watch this, because the stuff he was saying was way
Why
too
don't
smooth.
you love me like
right?
me?
Just like nah, we're not doing that. No, but that was amazing, man. Appreciate you so much, man. Really do. And we definitely
all right, you guys.
the best for sure. You got to come back, man.
Yeah.
Thanks, Ross. Definitely. Let me know.
All right. Till next time.
All right.